Welcome back. The Namibian Government, spearheaded by the Office of the Prime Minister in partnership with the UN Agencies and NAFSAN, successfully finalized and launched the revised National Food and Nutrition Security Policy, as well as its implementation action plan and a comprehensive coordination structure, which also clearly describes NAFSAN's role. The Director of Nutrition and Food Security Alliance of Namibia now joins us to shed more light on Namibia's nutrition and food security crisis and action. That is Mr. Ben Schernick. Good evening and welcome.
Good evening. Hi.
Thank you for being here. You had a workshop today with Arabian Media houses concerning this. Tell us about that. Let's start there.
Yes. So we invited, together with our colleagues from the Office of the Prime Minister, who are heading the advocacy group, some members of the media houses to shed a bit light on where we are in the process of the food and nutrition security policy, its implementation, and to highlight really some, or to share some of the facts why malnutrition is really an issue and why we would describe it as something like a hidden crisis that we're having.
Can you provide an overview for us, Ben, on the current nutrition and food security situation in Namibia?
Well, I think in the moment, because of the recent recession, the droughts, the COVID situation, and then also the current war in Ukraine, that together with the fact that Namibia has a highly unequal society, really leads to the malnutrition cases increasing. And what we're talking here is the number of malnutrition deaths of children under 5. We had in the news the Umaheke governor speaking about it, and we don't have the exact data yet. But if we take the data and compare it to data that we have from over the years, we are facing about 2 to 3 times the number of child deaths due to undernutrition. And that is just the tip of the iceberg that the Ministry of Health is seeing in the hospitals. But then they have to treat children, send them back into the communities, and the same children are back about 2, 3, 4 weeks later. So, and that we found in Umaheke and in ROUNDUP region, and it's similar in other regions from what we've picked up. And that is a crisis that, to our view, is not as properly identified as such, that we see it's actually happening.
How does NAFSAN address these issues?
So NAFSAN stands for the Nutrition and Food Security Alliance. We are the successor organization of an entity called NAFSAN, the Namibian Alliance for Improved Nutrition, and we are an umbrella organization for civil society, academia, and currently also the private sector, linking to the government coordination structures. So government revised about almost 2 years ago the food and nutrition security policy, and we are the link to the civil society, academia, and private sector organization into the structure, which comes with its own challenges.
What specific actions or strategies does NAFSAN propose to tackle the nutrition and food security challenges faced in the country?
So our role as an umbrella organization is not to implement projects, but our role is to provide reliable information in very practical and hands-on ways. So that also means to translate academic findings into day-to-day English or other languages. Secondly, our role is to coordinate, to link organizations, to look for synergies for those who implement or for those who want to do things with those who might have the resources or others who look for resources. And the third component is to advocate for changes. So for instance, breastfeeding is key for the first 1,000 days. Starting from conception until the child is 2 years old. So breastfeeding is really key for human development and for also social economic development in Namibia. So we advocate for extended maternity leave, maybe considering paternity leave, and given the huge inequalities that I mentioned, and the the abbreviation is lacking, agricultural organization. In their recent data, they spoke about almost 60% of poverty rates and of Namibians being malnutrition. So we're here talking about the majority of the population. And in order to address that, we're strongly suggesting a universal basic income, which can be balanced by other interventions like a sugar tax, which is basically a tax on sugary drinks to also reduce the intake of unhealthy food, while at the same time generating money that can be invested back into nutrition.
Yeah. This action implementation plan, or implementation action plan rather, what does it cover?
So the policy came with the implementation action plan and with a coordination structure. So the implementation action plan covers aspects around health, aspects around agriculture, food production, focusing on a variety of things there. Thirdly, around nutrition at schools, water, sanitation, hygiene, and also social protection, like looking into social grants for marginalized populations. And number 4, actions around the coordination. So these are the 4 areas basically that has been covered. The problem that we see is the lack of investment and focus on coordination. So there is an implementation plan, and the players, the different ministries and different other organizations do what they set out to do, but in the moment, because the secretariat that we have in place is not as sourced as possible and may not be, is most likely not at the right place in the moment. This is why the oversight of what we're implementing is actually not as much there as it should be.
You mentioned earlier that we don't have current statistics on malnutrition children in Namibia. Firstly, was that what you said?
Well, the latest data we have is from 2013, from the Demographic and Health Survey, and that showed us that almost a quarter of all Namibian children are stunted. And the cost of stunting, based on the COHA study, that's the cost of hunger study from 1 year ago, said that this amounts to 11 billion Namibian dollars in losses per year. So that's about 5.2% of the GDP.
Right.
So that stunting rate from 2013, the 1 quarter, leads into losses of 11 billion per year. So
why don't we have up-to-date stats?
I think we didn't do many of these census, or I don't know if it's a census or these surveys. I mean, they're quite expensive, and I understand that the budget wasn't there to do the Demographic and Health Survey, the last one, and I think the next one, I don't know exactly when it's out. But based on the fact that we went through the drought, the economic recession, COVID, and so forth, and we have stories that we hear from the regions where so anecdotal evidence that mothers are cooking cardboard boxes for their children because she doesn't have anything else to eat, or we have anecdotal evidence of people saying that they do not take the ARVs, the HIV and AIDS medication, because they want to rather remain on the small grant for food packages. And the lack of food is actually contributing to people not adhering to their TB or HIV medication, estimated between 1/3 and 2/3 of cases. So, I don't think that we're getting better, but it's really getting worse.
What are the obstacles or major challenges, facing the implementation of this action plan?
I think, it's the realization that it is really such a big problem, and that it's not just affecting individuals and families and whole communities, but us as a nation. So I think there needs to be a collective realization of the problem so that we can really invest in it. And secondly, to really invest in the coordination of efforts. Because what we see is sometimes bigger players or smaller players doing very similar things parallel to one another, and they could have really saved a lot of time, efforts, and created synergies by doing coordinated efforts. Plus, if there's no coordination, you cannot measure the implementation. And thirdly, I think we need to really think a bit outside the box, and this is why we mentioned the universal basic income or the sugar tax or other measures that can be really smart and effective, especially considering that the majority of people is currently affected by undernutrition. So a universal basic income would hit the target populations with very minimum administrative efforts. And those who can afford it can pass it on to charity.
Ben, how does NAFSAN monitor and evaluate its effectiveness, in terms of its interventions in addressing the nutrition and food security issues?
Yeah. So as we are not really directly implementing, we are not the ones taking action. So our role is really to coordinate those who take action, which is then our members. So our role is there to be part of the government system as a supportive stakeholder, but also holding government accountable at the same time, or to have honest conversations with government about what's working and what is not. But we ourselves alone do not have the monitoring tools. So our role is a support role to the national system that is supposed to monitor. So yeah, our role is a support role here. And the tools we want to create is an online database or online management systems, as well as a newsletter to kind of share success stories from member organizations and to see how we can create synergies.
Yeah.
But we're also still a very young organization. Also just came into existence in 2020, and then came COVID. So we're also building up more membership and a broader base to really be more effective.
Yeah. Well, Ben, thank you so much for your time and for being here with us this evening.
Thank you so much for inviting us.
Well, there you have it. That was Mr. Ben Schernick speaking to us this evening. That wraps up today's edition of the Daily Roundup with Nina. We're back tomorrow, same time and place. So from myself and the team, it's good night and thank you for watching.
I love music. I love music. Bashateria 2012 the table. This get to the wash, I not to story, I you go